Good afternoon, everybody. Apologies for us getting started a couple of minutes late. Welcome to today's session of Healthy Discussions. Before we get started, just a few housekeeping notes for everybody. The chat box and Q&A feature are both open, so you can feel free to use those throughout. You can also turn on subtitles, which are auto-generated by clicking the CC button on the bottom left corner of your screen. This session is being recorded and will be posted on Quality of Care NL's YouTube channel in the coming days. I'd like to acknowledge that we're joining you from the ancestral territory of the Beothuk, and that the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups. We acknowledge with respect the histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. We invite everyone to offer land or territorial acknowledgements in the chat and to take a moment to reflect not only on why we offer these land acknowledgements, but also ways your life and work may contribute to decolonization and reconciliation. For those who aren't familiar with Quality of Care NL, we are a research and evaluation program based at Memorial University, and our goal is to improve social and health outcomes in our province. Healthy Discussions is a webinar series where we have quality conversations about health, healthcare, and social systems in Newfoundland and Labrador. Our goal is to engage with you on these topics with the aim of continuing public conversations during the ongoing process of health transformation in our province. Public discussion also contributes to the growth of a learning health and social system in Newfoundland and Labrador. On the screen right now, you can see a definition of a learning health and social system as defined by Health Accord NL in its task force report. The definition might seem a bit complicated the first time you read it, but what it really boils down to is a health and social system that continuously improves through a culture of best practice, evaluation, equity, openness, and collaboration. The system learns and gets better, resulting in better care and health for all, which is, I think, a pretty fitting definition based on the conversation that we're going to have today. Part of the definition states that individuals and families are active participants in all elements. So by engaging in sessions like this one, by being an active participant in your own healthcare and wellness, by talking about and acting on issues that impact us as a society, you are contributing to a learning health and social system in our province. Today, our discussion is going to focus on the new MyHealthNL app launched by Newfoundland and Labrador Health Services. And we're delighted to have joining us Danielle Porter, who is the Director of Patient Access and Specialty Clinical Systems with the Digital Health team at NL Health Services, and Dorothy Sr., who's a patient partner on the MyHealthNL project. Joining them for today's discussion is Quality of Care NL Director Robert Wilson. Robert has some questions to get our conversation started, but we will also be taking questions from the audience. You can type your questions in the Q&A box, which sometimes is a little easier for us to manage. Questions can get lost in the chat sometimes as everybody chimes in with their thoughts, but you can also use the chat box as well. And since today's discussion is being recorded, you may wish to ask your question anonymously, which you can do so by using the Q&A instead of the chat or sending your message directly to me. So before we get started, we're going to show a video that explains to you all about the MyHealthNL app and what it is. So I'm going to start that video right now.
Introducing the MyHealthNL app, another way for you to securely view your personal health record and access health information and services easier and faster than ever before. Right from your smartphone or computer, visit myhealthnl.ca or download the MyHealthNL app from the Apple Store or Google Play. From the home screen, you can log in or continue as a guest. You will need to have a MyGovNL account to access your personal health record within the app. Log into the app using the same email address and password you use to access MyGovNL services. On the app, You'll find options to access different healthcare services and information. You can view your lab results and X-ray reports. Results display together, starting with the most recent at the top of the list. And you can also choose to group, sort, or filter the list to better see your information. You can click on the result or report to get more information. See your dispensed medications from community pharmacies across the province. Visit the Resource Hub for tips and guides to help you get the most of MyHealthNL. And explore dozens of medical conditions, symptoms, treatments, and more on the Health Library. Over time, the app will be expanded to include more features, such as a symptom checker, access to virtual care, service navigation, and more. Whether you're looking to manage your chronic conditions, monitor your medications, view your test results, have more informed discussions with your health provider, or simply access credible health information, MyHealthNL is your trusted health app every step of the way.
So I think that gave us a great overview of what we're going to discuss today. So at this time, I'm going to send it over to Robert Wilson, who's the Director of Quality of Care NL, and he's going to kick off our conversation with Danielle and Dorothy.
Thanks, Melissa. Danielle, my first question is for you. And now I know this video kind of gave sort of the Cole's notes of how to access your personal information. But can you perhaps tell our audience and walk us through how to access all this information through the app or website?
Yes, sure. Thanks, Robert. So if you have not already enrolled or registered for your personal health record, you should go to MyGovNL to enroll. You will have to create a MyGovNL account if you don't already have one. So from there, you select Use Service on the Personal Health Record Service card once you've logged in. And from there, you simply follow all of the prompts to validate your identity. So all of those prompts are outlined there on the left side of this screen. Essentially, you will need to be a resident of the province who is at least 16 years old with an active MCP card and a driver's license or a photo ID issued from government, so from the Motor Registration Division. And once you've validated these pieces, the last step will be to request a one-time activation code that will be mailed to your home address. And the address that we use is the address on file with MCP. And if you're not sure what that is, you will be asked to check that address. We will show it to you on the screen, and you will be asked to check that before you request your code. And if that address is correct, you proceed, and that code will be sent by mail and should arrive in about 10 business days, depending on where you live in the province. Once you receive the code, you simply log back into MyGovNL, go back to the Personal Health Record Service card, and enter your activation code. Now, one thing that sometimes people mix up is that there's this one-time activation code, but there's also a two-factor verification code on the MyGovNL site, and that might be a code that's sent to your email or to your texted to your phone, depending on how your account is set up, and you'll be prompted to put that in first. That's 6 numbers. And you'll be prompted for that before you put in your one-time activation code that just came in the mail. That one is a mixture of numbers and letters. So that's just a little tip, because we do find that people reach out to us who mix that up sometimes. Once you've completed your enrollment, you can continue on from there on the web, or you can go to Google Play or the Apple Store and download the MyHealthNL app. So the MyHealthNL app just gives you that easy access to your personal health record and other health-related information and services, as we just saw on the video. And of course, if you don't want to download the app or don't have a device to do that, then you can simply go to myhealthnl.ca.
Okay, so like it sounds like there is some good security measures put in place so that that anyone can access someone's personal information once that initial request is put in. So basically we have the app downloaded. Can you just walk the audience through what kind of information they're able to obtain on the actual app?
Yes, sure. So within MyHealthNL, in the personal health record section, you will see your laboratory results. Those are available 7 days after they are released and available to your ordering healthcare provider. So currently we have all laboratory results available except for pathology right now. So, but you will see all of your normal blood work and other tests. The amount of data in terms of the history that's there does vary depending on the region where you had your test done. But we do have some results that go back as far as 2015 in the Eastern zone, for example, and a little bit later in the other zones. We have medical imaging reports. Recently, we had an update that added all of the medical imaging modalities. So some of you who've already accessed your personal health record through MyHealthNL for a while may have noticed that in the beginning, we just had x-rays. But we did, within the last 2 weeks, expand to all medical imaging. So you should now be able to see your mammograms, your CT reports, those types of things as well. Those are available 14 days after they're released to your healthcare provider. And similar to the lab results, the historical data goes back to 2015 to 2018, depending on where you had your test done. We have a 2-year history of dispensed medications from community pharmacies. So anything you had dispensed from your local pharmacy will be displayed there. However, we don't have anything that would have been dispensed resulting from a hospital admission, for example. We have allergy information and information about any adverse drug reactions that you may have experienced. Those are coming again from the community pharmacy network. So if you reported that to your pharmacist, then that would have been entered in their system and then available here. We don't have any allergies that would be associated with your hospital visits.
Okay, thanks. So Dorothy, I'm going to pass it over to you, and thanks for coming to this, by the way. I was told that you were the very first patient to work on this and provided feedback. You were basically patient zero on this app. Can you tell us why is it so valuable for a patient to be able to access their medical records?
Excuse me. As a patient advocate, I encourage all patients and individuals to be aware and involved in your healthcare. To be involved, you have to know the results of your test. And this platform, which we've worked on for a long time and has had input from me in the building, because I've been involved from day one, to make sure that what was there was good for patients and useful for patients. So this app provides you with information that helps you be your own person in charge of your health rather than just waiting to go see the doctor. For example, how useful it is in today's environment in healthcare in Newfoundland, there's timely waits to get in to see your physicians. But if you're a diabetic and you have your A1C done, you can go in and right away, 7 days after, check to see if it's up. And you can start treating yourself really by bringing that A1C down before you even get in to see your doctor, because you know if it's gone up or down, and you can see that in real time in 7 days later. You might not have an appointment for 6 weeks later to see your physician, but you can start now taking charge of your own health care. That's just one example. There's many more. And I encourage everybody to get involved and see what's there. It's an awesome app with an awful lot of good information for us as patients.
Yeah, I think it's really sort of a movement in the right direction to make sure that the patient is sort of responsible for their own healthcare, right? And so providing this information will allow them to prepare and perhaps even prepare questions for when they have that face-to-face with their healthcare provider. Melissa, I'm just going to swing it over to you to see whether or not there's any questions in the chat right now. If not, I can move on.
Yeah, sure. Let me just bring those up. The one person wanted to clarify that app is accessible all throughout the province, correct? Everybody in Newfoundland and Labrador could access this if they wish.
That's correct. It's available throughout the province for Apple or Android devices.
Perfect. We also had a couple of questions submitted on registration by people who registered to attend today. And so let me just refer to those. We'll probably get into this a little bit later, but where was that question I was just looking at? Sorry, bear with me. Right. Are there any plans to allow parents to access their child's information on MyHealthNL?
That's a great question. We do have that capability, and we probably can get into more detail around how to share your record. But it's a little bit more complex when you're talking about wanting access to your child's record. So that capability is there. It is on our roadmap to do, and we've had some conversations. There's lots to work through there in terms of the policies and the procedures and how we validate you and your right to access the child's record. So that's what we're working through now with our medical records group and with the Department of Health Community Services, our privacy team, just to make sure that we're going to do that in a safe and secure way.
Back over to you, Robert.
Okay, thanks, Melissa. I noticed in your slides, Danielle, that you said there's a bit of a delay from when results are available to the healthcare provider when they're actually put up on the app. Can you tell us a little why that is actually happening and why is it so important to have that delay?
Of course. Yes, so this delay really gives your healthcare provider time to review the results themselves as well. They may reach out to you to book an appointment for anything that's abnormal or anything that requires follow-up and a conversation with you. It just gives them that little bit of time to respond to those types of results. This decision was made following engagement with primary care providers and with patients to ensure a smooth transition as we're introducing MyHealthNL into the health system. Something like this is really affecting a big change to the system on both sides for patients and for their providers. So it was really about an opportunity for us to kind of ease into it. It's also following in the path of other jurisdictions. So other provinces have started with similar delays, especially for more sensitive results. And over time, as people and clinicians have become accustomed to it, they were able to reduce or remove the delays. And we anticipate that we'll do the same as well. Dorothy, you were engaged as well in those discussions all along. I don't know what you think about where we are today and where we certainly hope to go.
I think that in terms of the results that are up there, they're getting put up fairly fast, faster than I anticipated. The discussions with the physicians were very valid in what they were concerned about, and we came to a consensus that the time frame is adequate. And as a patient, I'm okay with that time frame. It takes me that long to get ready to want to even look at it and download it and consume it. You have to remember that the information you're reading is often, something that you don't understand, and you're going to have to look for further information, which we'll discuss later about as well. But no, the system is doing exactly what we worked so hard to achieve.
Mm-hmm.
And in my discussions with many patients, they're very happy with the app. Everybody, I think our numbers are up now, aren't they, Danielle? That how many have joined?
Yes, yes, we have over 100,000 people that have requested codes to sign up, and we have about 87,000 people that are active users. So that's significant.
Yeah, and I push it with everybody I see to join and look and become, engaged with their health care.
Right. And I would imagine that delay would mitigate any sort of sense of panic or the healthcare provider being kind of blindsided by a patient worrying about a result. Would that be truthful to say?
Yes, it just gives that extra time for a clinician, especially around the more sensitive results. So,
Right.
I expect over time probably less sensitive results. Things like Dorothy talked about with the A1C, things that people are used to seeing and knowing what that means. We can probably remove the delay there. But for some things, like when we add pathology, for example, likely there will remain a delay for some of those more sensitive things.
So Danielle, in addition to accessing your personal health records, what else can we expect from the app?
We do intend to continue to grow over time, certainly, but what we have there today is access to a health library of information about health conditions, tests, procedures, medications, things that can really help you understand the tests and your results. That's available right now through a link you'll see there at either within the system. There's a little box that you can click on for the health library. And that's curated information that's actually reviewed by Canadian clinicians as well. So it's safe and trusted information. Right now, like I said, you do have to go to that library and search for what you're looking for. In time, we hope to enhance that experience so that when you click on your lab test, you'll be able to go right from that lab test. Perhaps there'll be a little question mark and you'll be able to click and get that information directly without having to go to the separate link. We also have links to online mental health supports through Bridge the Gap. We have some information that you would see at the bottom of the page for helplines and other health-related resources. We also have a resource hub, and you can see it here on the screen. So that's where you can go to see frequently asked questions, get tips, understand what you might be seeing on the screen, or how to find something within the app. Training and education materials, I suppose.
So Dorothy, I'm going to pass it back to you. As a patient and a patient partner on this project, how important is this sort of resource hub and health library that Danielle just mentioned?
It's very important. I actually used it this morning when I was looking up results of a test, because we all don't understand the language that are in these results we see. So I just clicked copy and paste and put it in the little box, and it brought me right to the resource hub and explained it so in language that was very consumable for me or patients. And I was also very surprised by the infographics and videos they have available for you to watch about the particular word you're curious that's come up on your results, particularly in the diagnostic imaging results, because they're very detailed. And, as patients, we read them and it's like, oh, what is this? We don't understand it. But this resource hub is very resourceful for us as patients to help us understand our health condition. And I encourage you to use it. And it's not full of everything you see in Google. It's very plain language, good videos, good, infographics that we can understand. And I'm very impressed by it.
Yeah, I think we've all heard of the term Dr. Google, where people can just go down a rabbit hole of searching, some of their ailments, and then perhaps it causes some worry. But I think it's so important to have this trusted information within the app so that people can do their own research and find out some of the questions and why they're getting certain results within their app. I'm going to pass it back over to you, Melissa, to see whether or not there's any more questions coming in from the audience.
Yeah, for sure. A couple of questions about users being able to engage with the app specifically. One person wonders how would they make changes to the data in the record if they see errors or changes in their medical situation. And that kind of goes hand in hand with some other questions that people asked, if they would be able to log their engagement with the healthcare system, for example, times that they've had appointments with certain providers or consultations with, for perhaps a pharmacist, just so that all of that information is in kind of one place. So I wonder if Danielle could talk a little bit about any plans for the user to be able to add to their health record from the other end.
Thanks, Melissa. Yeah, that's a great question. I think there's a couple of different things in there for sure. One thing is regarding if you see something that you feel should be corrected, then you should go back to your provider that ordered that test and ask about that. Perhaps it's just something that you need to understand, or maybe it truly is something that needs to be corrected. And, I think that's one of the benefits of having access to your record is really about being part of that team that, can ensure the quality of the information that's there. So on that topic, on that point, I would go back to your ordering provider to have that discussion. In terms of being able to see your visits with the health system, that is an enhancement that will be coming in the future, where you would be able to see a record of your visits with a hospital, for instance. So that's coming. And with regards to the last piece of being able to enter information yourself, that is not there right now, but that is something, again, that we should be able to do in the future. We would probably start small with there. Perhaps it's being able to add information from a device that you wear or something like that. Certainly that's part of the longer term roadmap. But yes, we do envision that capability in the future.
Some other questions from the audience are wondering about, you mentioned that you've added the ability to see your medical imaging reports in the app now, which is a new feature that just launched this month. Someone is wondering when you might be able to see the actual images that are taken, for example, in an X-ray, I guess, or a CAT scan, MRI, that type of thing. Right now, you just see the report.
Yes, that's correct. Right now, it's just the report. We don't have the capability right now to view the image. Again, that one has come up a couple of times. It's kind of a keep in view for us as the product evolves. And of course, we are still dependent upon the broader technology in the health system today. So as those are improved upon and enhanced or upgraded, more capabilities may be available, and we can go back and visit some of these things, but it's currently not available.
Would you like me to keep going, Robert? There's a couple other questions.
Yeah, sure. Why not?
Someone is asking how Newfoundland and Labrador compares to other provinces and territories when it comes to access to personal information. For example, the type and the level of access that we're giving to patients here, how does that compare with other provinces? And I'm sure when you were developing this app, you would have looked at what was being done around Canada.
Yes, for sure. Connecting with our counterparts in other provinces was a big part of our early work, and it's ongoing. Just last week, we met with PEI as well. They reached out, very interested in what we're doing with MyHealthNL, and had a number of questions as they're embarking on their own journeys. And that's where we were in the beginning, reaching out to other provinces that already did have personal health records in place, and people could access this type of information. So I would say that, some are further ahead than us. They're starting to, for example, expand to other clinical documentation like clinic notes and that sort of thing. But overall, I would say that we have made huge strides in catching up to the rest of the provinces that already have something, and certainly we're ahead of a number of other provinces that are currently working on this right now. as I noted, other provinces started with delays like we did, and they were able to reduce or remove, and really we're following along from their lessons learned and their experiences as well. So lots of cross collaboration. We've spoken with Alberta, Saskatchewan, BC, Nova Scotia, and Ontario.
Back to you, Robert.
Okay, thanks, Melissa. So Danielle, this question's for you. With permission, can someone share their health records? Perhaps someone like a next of kin with their personal health information.
Yes, absolutely. You can invite a trusted caregiver or a family member to view your health record. This feature is located at the top right of the app or the web page if you're in there under sharing permissions. The person that you invite will receive an emailed notification about the invitation, and they will need to log into their own MyGovNL account in order to accept your invitation. So both parties, both you and the person that you shared with, can end that access at any time. On each side, you can go in and end that. And also when you're initiating the sharing in the beginning, you can set an end date or an expiry date on that access. Perhaps you're going through something in the short term and you want to provide access to someone, and you know that in a couple of months, you won't necessarily need that person to have access. So you can set that right up front. I will note that this sharing does give them access to view your full health record of information that's available in MyHealthNL. We do expect the ability to fine tune that in the future so that you can share some things, but not all if you choose.
So just to follow up on that, Danielle, and to be clear, you talked about a caregiver perhaps because someone might not be able to, be IT savvy or just even understand the information. That initial request still has to come from the patient. Is that correct?
Yes.
You can't be someone that, I'm speaking on behalf of my mother or father or, my disabled loved one and make that access request to mygov.nl?
No, not right now. That is
Okay.
in your control. You have to have your own account, and then you control who accesses that. We recognize in certain situations there that may be difficult, and we may be able to put policies and procedures in place in the future to close some of those gaps for people.
Okay, thanks. Dorothy, this question's for you.
Sorry, Robert, just before
Yeah.
you go on, I just want to continue on that question because there was a comment in the chat, somebody who asked about if they had power of attorney, let's say, for their parents who were in a nursing home. That probably would be one of those tricky situations, Danielle, where they would be looking to access their parents' personal health records, but that parent may not, or patient may not be able to grant that permission.
That's right. This is not meant to be the same, even though, if the situation is right, you certainly, use MyHealthNL to be that same scenario, but it's not meant to be the same as that legal process. So yes, unfortunately, that would fall within the gap right now of how it works.
Dorothy, I got a question for you, and for anyone who's within the patient-oriented research realm will know that you are involved in many, many projects and many different committees. So can you kind of explain to the audience the concept of public and patient engagement and why it's so important?
Well, as patients and being engaged in research and in the healthcare environment, you have an opportunity to sit at the table and work with the professionals that are engaging in change and for the future of our healthcare system. For example, I was on the health accord, and I was a vocal person on the health accord, and I was equal to everybody else that sat there. So that's why patient engagement is so important, because we can make change through our lived experience as patients of what we see is necessary for us, not what the professionals or the scientists or anybody else sees, but what we see. And in the research, There's so much up and coming research that you can sit at the table, be actively involved as a patient who's being part of the research or as a contributor to the research. And the opportunities are numerous, and the exciting things you see that we can be involved in from our kitchen table at home. We don't have to be in the room. So everybody has an opportunity to sit at the table, to voice your opinion, to be heard. And my saying is, and as it is, as many patient partners say, nothing about us without us. So have us involved and be vocal and say what you want to say to make a difference. You know, we are being heard. As you know, Danielle will attest, from day one, I've been involved in this program, and the whole team has allowed me opportunity to voice my concerns or my recommendations, and they've been heard. And that's what's important. We want to be heard.
I mean, it's well said, Dorothy. And so if anyone like online, can you perhaps explain if they wanted to become engaged in some sort of work and wanted to be a public and patient partner, how would they do that?
Well, there's a couple opportunities in this province to be involved. One is with Newfoundland Support at MUN, which is a SPORE entity, which is, let me get this right, Robert, because this is where I get mixed up, a strategy for patient-oriented research. There's many opportunities to be involved at different research that's happening here in this province and across country. And it's meaningful research, and many of us are involved in provincial, national, and international research now that we've been involved so long. So that's one opportunity. We have, with Newfoundland Support, there's a patient advisory council, and we sit on that and we provide input. And we're on a number of other committees that provides input to the academic research network. Now with healthcare, the Newfoundland Labrador Health Systems Services, get that right? They have people-centered care program where you can become a patient advisor and sit on different types of committees, and you just need to contact the Health Newfoundland Labrador Health Services to find that app and join or offer your assistance to become a patient advisor. And again, you sit at the table and you're heard, and you make change, and that's vested. And this all goes right as far as government. So policy change starts with us. If we want to see change in healthcare, we have to be part of it. So patient engagement is your first step to be part of change.
I mean, it makes sense, really, right? I mean, at the end of the day, the patients and the publics are the one receiving these services. So, I mean, getting them involved and getting their perspective and lens on any sort of evaluation or research or the development of a new technology like this app is extremely important because they're the ones who are going to be using it. Melissa, I'm going to pass it over to you one more time. I only have one more question left for Danielle, but I want to see whether or not there's any more questions or comments popping up in the thread.
Yeah, sure. I will share one comment from one of our audience members. Mike shared in the chat that he had experience earlier this year, shortly after setting up the MyHealthNL account, where the new app saved him some stress in not having to wait for test results from his physician, who was a specialist. He was able to check the results without having to go back to the doctor right away, and it saved him some stress and saved the system, he thinks, a little bit of money, making things a little bit more efficient and a better use of the doctor's time when he did get in there to see it. So that was just one example of being able to take a little bit more control of your own healthcare in a system where often it can feel out of your control, which is why we're working on this whole process of health transformation in the province here now. And it does help you be better prepared when you go to see a physician, when you finally get in there, to make the absolute most of your time there. If you're a little bit more prepared to discuss the results of the tests that have been ordered.
Thanks for sharing that. We love to hear feedback like that. That's really the perfect scenario, the perfect story of the benefits that this brings for sure. And it brings a lot of meaning to our teams. You know, this has been quite a long journey, so we love hearing things like that. Thank you.
Melissa, have you downloaded the app?
I have, yeah.
Okay. Yeah, I'm the odd one out, but I will download it right after this.
You were waiting for
I
this.
didn't know that,
I was
Robert.
waiting to see whether or not it was worth it, but it got me sold here. Is there any more comments or questions?
Someone has asked what are the prevailing views of healthcare providers on the new system. So Danielle, I don't know if you want to share a little bit about what you heard from healthcare providers when you engaged with them before launching the app, and what they thought about this idea of patients having access to their personal health records.
I would say it was a mixture for sure. Overall, you know, everyone recognizes the patient's right to have access to their information, the information about their health and their own test results. But we did hear some concerns about, I guess, the potential for it to mean more phone calls, especially within the primary care setting. I think we're all familiar with the pressures that are there today in primary care and how difficult it is oftentimes. So I think there was some thought or fear that it might drive you know, more phone calls and more of that kind of administrative burden that clinics are already bearing. But certainly we heard, you know, as much from the other side about how they understood the value and how it will drive more meaningful, more efficient conversations with their patients, improve the relationship with their patients, perhaps reduce the need for some unnecessary appointments for normal test results that people are quite familiar with. So, you know, freeing up some clinic time for you know, others who would need to be seen. So it was definitely a mixture. And I would say that what we heard very much reflects what we heard when we engaged with other provinces and their journey and what they heard from clinicians. You know, and over time, I think a lot of those fears were allayed, or it didn't materialize to the level that it was thought that was possible. We also intend to do a survey of clinicians over the next short term to gather their feedback and make adjustments as necessary, because this really does need to work for both sides as well.
Mhm.
Sure, and I think that kind of goes back to our earlier mention of the health library and the resource section of the app, because as Dorothy mentioned, it's not like if you were to take your get test results and paste them into Google. You know, anytime you look up any kind of healthcare information on Dr. Google, it's pretty scary. It really is a lot of information to wade through. But when you search in the health library inside the MyHealthNL app, you know that you're not getting a lot of that outside noise that you can get on Google and just generally on the internet. You know that the resources that are appearing have been reviewed and curated by professionals at NL Health Services, and it helps you kind of focus, learn a little bit more about the test results or the report or whatever it is you're trying to learn about, without the extra noise, or without having to use you know, that mental capacity to weed through what is a trusted resource here and what isn't, like you would on Google. But within the app, you already know that it's a trusted resource, and the information you're seeing is valid and relevant to you locally here, because that's the other thing I find when you're just out there on the internet and on Google. You might hear some stuff from different healthcare systems around the world, and it's not necessarily applicable here in Canada or even here in Newfoundland and Labrador.
Hey, I got one more question for you, Danielle. Are there any new features that the people of Newfoundland and Labrador can expect from this app coming in the near future?
Absolutely, we have big plans. So we have a plan or a roadmap, we call it, to continue adding more information and more services to MyHealthNL. You can expect to see updates about every 3 months, but sometimes more frequently. So, for example, I mentioned that we recently expanded the medical imaging information that's available, but now we're at the beginning of October, we're going to be adding a symptom checker. So that symptom checker is kind of part of the health library service, and it will help people make more informed decisions about their health and to understand next steps in seeking care and what the appropriate care would be, for example. Before the end of the year, we also expect to add pathology results, and we're working on other features as well, like service navigation. I think that was mentioned in the video. So that would be like how to find your closest pharmacy or family care team, information like that. We're also working on the ability to complete a self-referral to provincial cancer screening programs. So we've had lots of great conversation with the provincial cancer program about how we can leverage MyHealthNL to improve and enhance their services from a patient-centered approach as well. So we're looking at adding self-referrals for breast screening and colon cancer screening, for instance. We will also integrate to virtual care services that are available to people, for example, who have registered through Patient Connect NL, people who don't have a primary care provider. We have a long list of things. We're talking about a chatbot as well, and we get excited when we talk about things like that because we envision that you can use the chatbot to perhaps talk about your symptoms, and maybe you have symptoms of an eye infection, and through that interaction, you know, you may find that, well, your symptoms indicate, you know, this type of issue could be seen through your local pharmacy instead of having to go to the ER or make an appointment with your family provider, which may take some time. And then, you know, it would navigate you to your closest pharmacy, for instance. So that's the vision, and we get very excited. I think what we're doing with MyHealthNL is leading the country from many aspects, because other provinces have apps like MyHealthNL, but we're, I think, one of the first to start with that immediate deep integration into your health record. So really giving you that big value right up front, and then continuing to add other things like navigation, your appointments, and things like that.
And I find that so interesting that you're going to avail of like artificial intelligence within the app, as opposed to like they could just ask the question as opposed to even using that resource hub and library.
Yes.
And I would imagine all that the information that the chat box will produce from the question is within the information that is within the app.
It'll still be based on, yeah, our curated and controlled information. Yes.
Okay, Dorothy?
I'd just like to add, Danielle, you were talking about getting excited about what's coming. Even the upload of the diagnostic imaging has created conversation in the public. People are excited, well, happy to have access to it, and it's creating conversation, and we can hear the difference when I talk to people I know that are accessing it, and people are texting me and emailing me. So it's good work for good value, and we're seeing the positive outcomes. So just imagine what we can do in the future. That is very exciting.
Absolutely. Melissa, is there any more comments or questions coming from the audience?
Nothing too specific, but I did have one question from someone about actually accessing the MyHealthNL app. So just want to clarify that you log into your MyGovNL and you request access to your personal health record. They mail, you confirm your address and all of the other things you need to confirm. And in the mail, you will receive a piece of paper with a one-time activation code. You go back to MyGovNL, you enter that one-time activation code, and now you have access to your personal health record. So via MyGovNL or the new MyHealthNL app, you download that and it asks you to log in. What you log in with there is your MyGovNL credentials.
That is correct. Yes. Yes.
And at that point, every time you log into the app on your phone, it will say, we want to confirm your identity. Please check your email or your text messages for a special code. So after you've entered that piece of paper code once, that is done. You don't need that anymore. But after you log in on the app, you do have to confirm your identity just with, it's called two-factor authentication. And you just take the code from your email that they send you when you're trying to log in, or your text messages, depending on how you have it set up, and enter that. And then you log in and you have access to your full personal health record there. So it can seem a little bit confusing or daunting, but it really is all down to security. These are your health records we're talking about. So we have to be 100% sure that the person who is accessing them is the patient themselves.
Absolutely. Yes. That's a great summary of the process. And yes, there's certainly a number of steps for the first time when you're trying to get enrolled, but it really is about ensuring your identity and the privacy and the security of your health information.
So if there's no more comments or questions in the chat, Melissa, before I pass it back over to you, I want to not only thank Danielle and Dorothy, but congratulate you guys on this. On this project, this fantastic project. I know it's always going to be evolving and ongoing, but to see this released is absolutely fantastic, and I think our audience members and people across the province will agree on that. So once again, congrats. And thank you for coming online to explain to our audience how this application works.
Thank
So
you
Melissa,
sorry, I just want to take a
Oh,
moment
that's all right.
to thank you as well for the opportunity today. We love any opportunity to talk about this. And I want to thank Dorothy as well. She has been here from the very beginning in terms of the personal health record piece. It took us a number of years to get this going. And I think about, I don't even know how many years ago it was when we traveled to Halifax in the early days to attend a conference. There was a citywide blackout when we were there, so we had quite an adventure. And I always like to say, we've certainly moved on from the dark days and look at where we are now. So it's very exciting, and I really, really, and the whole team appreciates your important input,
Okay.
Dorothy, and your support.
Well, that's what I like to say, take a plug to say that it's important to have patient engagement. So I encourage everyone to take control of your own health record and your own health. Get involved. And if you want to be involved in patient engagement, you're certainly welcome to reach out to me. But Robert and Melissa put up a few links there. And that can initiate change, just as this has in this province. So we welcome everybody. I'm saying that, but I hope we are welcoming everybody to join. Thank you.
Thank you. Thank you, Danielle and Dorothy, and everybody who joined us online today to listen and participate in our discussion. Just a reminder that the recording of this session will be available on our YouTube channel in the coming days. And you can check out all the recordings of our previous healthy discussion sessions there as well. And the last thing, you'll see a very short post-event survey on your screen after we end the webinar. We really appreciate you providing any feedback or ideas for future healthy discussions topics. So once again, thanks to everybody, and I hope you have a great rest of your day.
Thanks.
Thank you.